Okay, well, I think we'll get started. I'm going to call this meeting to order. We're going to have a kind of a rearranged agenda today because we do have a guest visitor that would like to speak to us. But I want to make sure for attendance that I'm not missing anyone. I have Lisa, Joseph, Debbie, Sherry, Marcella. Is there anyone else on the call I missed?
Hi, this is Lisa Palucci on the call.
Oh, hi, Lisa. Good to have you.
Hi.
Our new board member.
I'm sorry, did I hear someone else?
She's our new board member. Lisa and I work together, so yeah.
Right, I thought I heard another voice, so I wasn't sure if I missed somebody else. Okay, well, I'd like to introduce Emery Realbird. He's visited with Ron. He's a volunteer with Connect for COVID. And Emery, I'll just turn it over to you.
Sure, thanks. And that was Tammy, right? Just introduce me?
Yes.
Great. All right. Thank you, everyone. My name is Emery Realbird. I'm a member of the White Mountain Apache tribe from Arizona, half Crow in Montana. But yes, I'm a volunteer with an organization called Connect for COVID-19. It's an organization underneath the Digital Health Connectivity Project out of the Community Foundation of New Jersey. So we're a fund of the CFNJ, but what we do is primarily provide smart devices, usually tablets or smartphones or computers, to hospitals or other types of healthcare settings, either for telehealth. But one of the big items we also focus on is connectivity. So during the COVID-19 crisis, we have partnered with hospitals to provide COVID-19 patients with smart devices to keep them connected to their kind of families during this their recovery. But one thing that we also found out was that nursing homes are also an area that needs connectivity, especially in Indian country. We want to still be connected to our elders, and because of a lot of the very stringent visitation policies, not only in hospitals, but in other healthcare settings like nursing homes, we felt the need to expand that scope to include that. In our organization, we have provided outreach to about 15 nursing homes in Rhode Island, and that was through another association similar to U.N.I.T.E. So when I was looking at the Crow Nation in Montana at their nursing home, I kind of did a little bit more searching and found the association. So I reached out to Ron more generally to see if this is something that would be of use to kind of the association members. We do have the ability to kind of work with each stakeholder and figure out their need. More or less, we were able to provide Amazon Fire tablets. They're kind of like a more user-friendly Kindle, if you will. So you're able to access certain types of video conferencing if you need, or reading apps, different lifestyle apps. But also in the past, especially in Indian country, we'd work with Indian Health Service in providing iPads, and also a different type of Google tablet. So what I wanted to talk to you all about is, do you feel there is a need for these types of devices to kind of your members to see if they can use these to stay connected? We do have kind of a chunk of funds set aside for Indian country, and I'm tasked with kind of reaching out to relevant stakeholders to see how we can support kind of keeping people safe, but also keeping people connected. And that's kind of the root of our organization. These are donations, so it would be at no cost to the facility, and they would become property of the facility. We only ask for kind of a follow-up saying, how has this been beneficial, and then just kind of an evaluation later on. But because we understand that each facility has their own kind of protocols and policies, we weren't in a position to kind of micromanage these devices. So in case of the 5 hospitals we worked with in Arizona, they became property of the IHS and then also the tribal clinic there. So we understand that making sure it's the easiest possible for the organization can help them kind of succeed in this role. So happy to take any questions, concerns you may have, or if you have any other clarifying questions. Thank you for having me.
Thank you, Emery. That sounds like a wonderful program. Do you have a phone number?
I do, yes. You can contact me at 928-369-8095.
Okay.
And then I did send an email to Tammy and Ron, but I give you my email as well, and that's erealbird. So just like how it sounds, a real bird in the sky. So that's erealbird@gmail.com.
Okay. One thing I can think that might be beneficial, U.N.I.T.E publishes a newsletter every month that goes out all over Indian country, and it might be nice to do a highlight about, everything you've just said so that other people are aware.
Sure.
Would it be best if each individual facility that's on today just contact you directly?
That works. I think from my perspective, it would be helpful just to see if from kind of everyone on the phone, is it something you're seeing kind of is a need? Is there already kind of a plan in place at most nursing homes to kind of keep people connected? Kind of how is that going? Or is there just not enough staff? Like, what's the background there?
I can only speak for Morningstar. We applied for the CMP funds for the Never Too Late program last year, and so we were able to receive a portable screen that has an arm that if you're laying in bed, the arm can put it over to the elder, and a big screen, and then some little tablets. So that's what we've been using for our telehealth needs and for elders to communicate. But I think a laptop computer would be wonderful, too, that you could take into each room. I don't know what everybody else's thoughts are. Anyone?
This is Lisa, but I'm going to invite Marcella to pipe up because I know I'm not sure if you got the CMP funds, Marcella, for Kotzebue or not.
We did, and we have the tablets that were available. But now, Jeremy, you said that you also have smartphones available?
Yeah, that's on a limited basis. It just depends on the need. So right now we have kind of the set-aside money, and that could be converted to either tablets or cell phones. But most likely the cell phones would be refurbished. And the only new product is the Amazon Fire tablet. And all the Apple products that we use, we have a relationship with the supplier that provides kind of refurbished, factory refurbished items. So.
Okay.
The cell phones sound like an item that would be helpful.
I think a cell phone would. We set up for Zoom meetings and for, but the problem is there's a lot of people in our village that does not have smartphones, so it's hard for them to call in. But if we had a cell phone where they could come to the unit and to the designated visiting area, maybe they could use the smartphone, and we could have a little more contact with the elders, between elders and their family.
Okay, and would a smartphone work because it's connected to a cellular signal, or could this be like you set up some type of area with a tablet connected to Wi-Fi?
The cellular part of it.
Okay, yeah. We don't provide kind of the cellular plan, so that's something that the facility would have to pay for.
Yeah.
That is a question we get often because I know connectivity in Indian country is not great. So we can provide tablets or cell phones that have a SIM card feature. So Apple iPads and also phones have SIM features so that they can connect to the internet.
Okay.
So we could provide, say, an Apple tablet, Apple iPad that has connectivity with a SIM card, and then the facility would just have to provide the SIM card.
Okay. Wow, that is.
This is Lisa. I'm not a very tech person, so I just want to make sure if I'm understanding this conversation that if you could provide like the laptop version or the iPad version, there's a way that in Marcella's facility the family could use that laptop or iPad outside, in a waiting area or some kind of socially distanced area, and be able to connect to their Wi-Fi so that they could have that call with the resident. Is that what I'm understanding?
Yes, that's what we need.
Yeah, so I think in this instance, Wi-Fi is the, stable option. If it has connection to Wi-Fi, most tablets or cell phones can connect to it. But I think what I'm understanding is that there are instances where Wi-Fi is not available. So there are iPads or smartphones that can use a SIM card similar to a cell phone that can connect to the internet to provide the connection.
So with the SIM card, you don't need like the cell service package. You just, I don't understand what a SIM card is. I'm sorry. I don't want to take the meeting time.
Sorry. No,
well,
that's totally fine.
I don't want to waste our time because I'm probably the only one here that is struggling to kind of figure all this out. But it sounds like with that SIM card, though, you don't have to buy like an AT&T phone package.
It wouldn't be a phone package. It would be a data package. So you'd still have monthly recurring costs if it was a SIM card. And that's why with most of the facilities we work with have Wi-Fi areas designated. So in the case of a tribal hospital or IHS, they have a guest Wi-Fi that you can use. And sometimes in the parking lot or in the waiting room, they're able to connect that way. So in this instance, if there's already that availability, that's the easiest way because you don't have that recurring cost.
Okay, so Marcella, I guess that's the question for your IT folks is, or if you know already, if you've got any Wi-Fi hotspot kind of areas, that sounds like this might work for you.
Yes, I think it would.
Yeah, definitely. And we're happy to kind of explore those options in terms of providing it that way. But again, we would hope that these don't become kind of not individual property of the family, but still property of the institution, if that makes sense.
And it would stay with us, but it would, when they would come, we could share it with the different families as they come to have
exactly.
Yeah.
For sure. No, definitely. And that's what we envision because we want to support in that way. So that's definitely a use that we can support. It's just a matter of making sure we get everything together. So I know you do have other options or other agenda items. So happy to take any more questions or concerns. And then also, Tammy, if you don't mind sending I believe I sent a PowerPoint deck, and that kind of goes over our organization.
Okay. I'll make sure that everybody gets it. And I will give that to Julie. Her name is Julie Cahoon. She is our representative for KAI that does our technology as well as the newsletter. So she might be reaching out to you to visit a little bit more about this program.
Sure. No, definitely. And I think we do want to help earlier rather than later. And I think with especially a lot of the supply considerations, because everybody is remote right now, not only workers, but even school. So there is a kind of a dwindling supply of different smart devices. So I think the earlier we provide or get a need from a place, then we can fulfill that order sooner rather than later. So that's just some environmental items. But I'm happy to provide any context I can from the newsletter with Julie. But thank you for giving me some time today.
Thank you. Thank you very much for your information, Emery. We appreciate it.
Of course.
This is Melissa. I'm with KAI, and I sit in for Julie sometimes.
I just wanted to get Emery's phone number again.
Okay.
Sure. My phone number is 928
Yeah.
369-8095.
All right. Thank you.
Of course. And I'm based in Washington, D.C., so I work on East Coast hours, but happy to take your call at any reasonable point in the day. So.
Okay, great. She's based in Washington, or she's based in Montana, but I'm in D.C., so if I need to reach out on her behalf, that's great to know.
Okay, no worries. And yeah, I work with another Native association here in DC, so I'm just doing this on my own time, but happy to support in any way I can. So.
Thank you.
That's very nice of you, Emery. Okay,
Of course.
Thank you very much.
All right, thank you. I'm going to hop off the call now to leave you to the rest of your call. Great.
Okay.
Thank you. Have a great day.
Bye-bye.
Bye.
Thank you.
Okay, moving right along, we don't have minutes. I'm not sure who took them last month because I wasn't able to be on the call. So I'm going to just bring up the treasurer's report briefly. I think Ron sent everybody the report. The only change this month is the additional $5,000 we got from the NCAI grant. And so, Joseph, if you could give us a little report about how that's going for you and what's happening with it. Are you on, Joseph? Okay. Well, I don't know what happened to him. Joseph?
I know he was trying to get into the call earlier. Something must have come up.
Well, he was on for a minute, so I don't know, he must have dropped him off or something. So anyway, for anyone that's not aware, that $5,000, we are using it. Joseph is reaching out to all the Native nursing homes, trying to reach out with COVID, because we are doing the COVID report, and but as well as telling them about U.N.I.T.E, and so we'll just see what his report is the next time we can talk to him. And then that brings me to Julie had talked about the COVID update. Is anybody on the call that has any new information? I mean, I know I continue to send my information from my nursing home in. We haven't had a COVID meeting for a little while, so I don't know any other updates on that. Melissa, do you know any updates?
No, I was not provided with you.
Okay. Then I wanted to bring up Julie and the newsletter. So just remember that, if you have any pictures or anything fun going on at your nursing home, please send them in to Julie, and she puts them out in the newsletter. And then does anyone have any other new business before I turn it over to Sherry? Well, I guess I will turn it over to Sherry with LeadingAge, and we'll see what Sherry has to tell us today.
Hi, good afternoon. I'm sorry I got bounced off the call and had a hard time getting back in.
Me too.
Well, I'm sorry.
That's okay. I'm sure it's something around here. It looks like we're going to have a thunderstorm. So I have a couple emails out to our staff to verify what next steps are for the planning process. Joseph, has anyone reached out to you from LeadingAge at this point?
No. You had sent me the person's name that was supposed to assist me, but and I think I wrote to her, but it never happened. So.
Okay. Well, thank you for letting me know. I think it was Margaret, and I'm going to pull together our team at LeadingAge, and if what I can do is get a good phone number for you so that, and of course I have your email so that we can set a call in the next couple of weeks so we can get something together, start getting some ideas. And what you want to do, and then, what the board feels like they would like to do, and hosting their meeting, and then for a booth space, virtual booth space, and then any other details. So do you all want to have a membership meeting virtually during the annual meeting?
Anyone have any thoughts on that? I know several of us are registered for the meeting, and that's normally our annual meeting. But Debbie, are you still on the call? I'll send out an email, Sherry, and have everyone take a vote since we have a lot of missing people today.
Okay.
And I'll get back with you on that.
Okay, that sounds fine. And then the booth is a separate, I say booth, but like in the exhibit experience, we can talk, Joseph, together with Margaret and find out kind of how that will work. And then it might help you and the board kind of in membership think about what you would like to do. And Margaret's so much more well-versed in all of this than I am, given that's her, her role, that she can probably give some ideas as well.
Well, my understanding, Joseph, weren't you and Tori working on a booth? I thought Tori was helping.
Thank you for that update, Sherry. That's correct, Tammy. My thought was to have our tribal symbols and any emblems from our nursing facilities that we could put on a virtual loop, on a continuous loop, with a message from our president and right, Tammy? And something like that was my thought, just to have that presence again, showing what tribes we represent, and again our facilities. And I reached out to Tori with Native American Health Management, Ron's organization, and he and I are attempting to create that for LeadingAge conference.
20 to 30.
Okay. All right, so let me check in with Margaret because the virtual experience is so different, and I want to make sure that whatever you and Tori are developing is going to be compatible with what could be placed on there, and maybe what format we need and that type of thing, because I don't know. And so I want to make sure that early in this process that we're giving you sort of the specifications that would be needed, and maybe a tutorial showing you all what it looks like.
Well, if we could include Tori Monahan on that email loop, that would be good, because again he's the tech on our.
Okay, sure. I see his name here. I apologize. Tori is a gentleman, or?
Yeah, he is a gentleman.
Okay. Okay, great. I will do that. I'll get something set up because I think it would be beneficial to see the platform, and then it may or may not alter what you two are thinking about and how it would be presented.
Thank you, Sherry, for your help.
Of course.
And I guess I'll send out a reminder email, if everybody's registered. I know Ron was helping those homes that he works with.
Yes, and I'm waiting to get a full registration list from our conference services team, and I was going to share that with you just to see who else may be missing. But I know, is the newsletter going out this next week?
Mm-hmm.
Okay. So I know that Ron had requested that I send him the link and everything. So if I will send the latest news over, and also just the link for the newsletter, the instructions, so that we can make sure if there's anyone that would like to register to please do so. And you all are at member rates, so if there's any concern when you are registering that you're not getting that rate, please just let me know.
Excuse me, Sherry, was there a deadline for an early registration? I think I saw that. Did we already pass that line?
We did, but honestly, I can certainly request of the conference services team for the U.N.I.T E. You may have to pay for the higher amount, but they can always refund you. I want to say it was like $100 additional. But
Okay.
if you run into that, if you were not given the early bird, but it just ended, I think on what's today? It might have ended on Tuesday.
Yeah, I think so.
Yeah, then please, let me know, or one of the board members, and I will gladly send me that information. I'll take care of it.
Thank you.
Mm-hmm.
Thank you very much.
So that's all for me today, unless there's some other questions.
Anybody have any other questions for Sherry? Okay, well, since Joseph is now back on the call, Joseph, can you give us an update on how the NCAI grant you're working on is going, and how your calls are going, or
right? The work is going slow, but we only received word that we have Ron and I were concerned because we did get an award letter and all that good stuff, but we didn't get a check with that letter. We had to submit our nonprofit document for U.N.I.T.E, and which we did, of course. And there was just such a long waiting game. I think we waited. We received word that we had received the COVID-19 grant from NC National Congress of American Indians to start addressing or creating a directory, reestablishing the U.N.I.T.E directory that Debbie and others worked on, and then just reaching out through the NCAI tribal directory to all tribes as much as I could. And that was the scope of the work, was just, again, real basic, compiling a list and updating the U.N.I.T.E list, and then creating a new master list with the tribes that are on the NCAI directory, which is over 200. And again, just starting to attempt to assess what's out there in Indian country as far as nursing homes go and long-term services and supports. And I created a Excel template with the listings of tribes, and then and then the questions that I'm asking. And I did reach out to Debbie to ask her for some recommendations on the questions to ask at these various entities. Again, it's good to have somebody from Alaska, 2 people from Alaska on our call today. Thank you, Lisa. Also, sorry if I confused you with all those bogus numbers, but we're finally here. We're finally here, all in the same place. But so again,
we got it.
It's progressing slow. Again, I'm cross. I also became, I think I was aware of this, but I also found another list that I'm cross-referencing because it's helping me get to the actual people, not just keep leaving messages. And that list I found with the OlderAmericans.org, their Title VI directors. Title VI is the federal program through the Older Americans Act, basically Meals on Wheels. So I'm cross-referencing my work with that list, not only utilizing the NCAI tribal directory, but also cross-referencing with the Title VI directors list, because again, it's helping me actually connect to people. So yeah, the work's going real slow, and again, my questions are real basic about what types of services the tribe is providing. If they have nursing homes, is it LT? Is it assisted living, adult daycare? What? Again, I would appreciate if membership today could maybe send me other questions I could be asking when I connect these tribes. Thank you.
Thank you, Joseph. So you're calling like any of the native nursing homes or assisted living places directly then?
Yes, I am. But
okay.
we have such a short list. I'm using the list that U.N.I.T.E created a couple years back.
Okay.
And the list I had still had Val as the administrator, but we have the new administrator on our call today. So again, that's the original list I'm working off of.
Well, good. It sounds like you've been busy. Well, thank you.
It's difficult because there's a lot of just leaving messages.
Yeah. I found that, Tammy, true when I, set up the original list that he's talking about. A lot of people answering the phone saying, oh, they're not here anymore. We don't really know. Try calling so-and-so. And then you'd call that number and there'd be, it was like ended and no one answering, or it's a little bit difficult. Joseph, just so you know, I'm happy to help a little bit with this too. So if you want to shoot me, like call these 5 people or something, I will get that done for you. So, because I think you're taking on quite a bit. So
it's a lot of fun, but you're right. I am realizing how daunting it is, but again, that just goes to show how much of a lack of information on the large scale there is. Because if NCAI was willing to fund this little project, they know themselves they don't have that info either.
Yeah.
But I don't know if anybody else on the call today saw that the National Indian Council on Aging sent out a survey a couple of weeks ago. Did anybody else fill that out?
I never saw it.
Again, it's part of that work that was funded, that we competed for, that U.N.I.T.E, part of that grant that we submitted for. And
that girl got the grant.
You're right. So they were just doing a real basic assessment. It was like about maybe 5 or 6 questions. I'll forward it to the U.N.I.T.E members.
Okay. Interesting.
Yes.
Maybe Julie, if you send it to Julie, maybe she could send it out to everybody.
All right, I'll do that. I don't think our U.N.I.T.E board member email's working, if I'm correct. I think that's what Tori had told me, that wasn't working right now, if that's right, Tammy.
Oh, okay. That's good to know. I know the prior meeting, I had been doing people individually and then just one to the U.N.I.T.E board email.
Something happened. I could be wrong.
Several people didn't respond, so I thought I better just keep doing the everybody's individual emails just so we make sure.
We need to make sure we get Lisa's email into the loop, because I sent her on how many different wild goose chases for this call today. So.
Right.
Well, I'm so sorry. Part of my trouble is I was struggling trying to figure out which time zone we were in, and I apologize, and all I can say is I'm trying.
So, Lisa, you don't receive an invite from Julie Cahoon?
I did not receive a calendar invite until during this call. I got a calendar invite. Let me see who sent that from me. Yeah, from Julie.
Okay.
But before that, and someone from LeadingAge, Sherry from LeadingAge, was kind enough to hook me up with a number and call in too. It's just a lot more helpful if I have on my calendar, on my Outlook calendar,
right, and
with the call-in information kind of all right there. So I apologize for being an outlier, and I'm hopefully getting it figured out.
Well, that's no worries. Melissa, are you still on the call?
Yes, I am. My phone is off. Yes.
Would you be able to speak with Julie to make sure, like Lisa and the other new board members are on her email when she sends the invite out?
Yes. And the new ones are Lisa and Marcella, correct?
And also Lisa. Yeah.
Oh, wait, two people were talking. What did you say?
And also Lisa Palucci is also a new board member.
And then we had Tiffany.
Shangro.
Isn't it Debbie? There was 3 from the Sioux tribe.
Yeah, there were 4. Well, Deb Arbogast, but she was already brought in last fall. But
what's Tiffany's last name?
Shangreau. Shangro.
Do you remember what are the other folks' names?
I have Marcella Wilson. That's it, right?
Ron sent that out. I mean, I have it in my files. I'll send it to him, Tammy. Don't worry about it.
Okay.
I know we've sent it before, but we need to make absolutely sure that these email lists are very, very tight. And my other suggestion is that these invites, Marcella, go out, or Melissa, go out the day before. I mean, that was kind of the arrangement we had with Julie. So the third Thursday of every month, we do our U.N.I.T.E meeting, and then 4 times a year, December, March, June, and September, we do our board, we do our board meeting every month, but 4 times a year we do the U.N.I.T.E call, right?
Yeah.
Which is September. But we want to make sure, like probably the day before that, or a reminder 3 days before, something needs to get sent out closer to the time. I think Julie and I had agreed a while back on like 3 days before, so that people have that and they can save it to their Outlook or Google Calendar or whatever.
And I think the 3 days before is good. I think 1 day before isn't, because then, just like right now, Lisa's just getting it. I don't know. It seems like it's not enough time just 1 day before.
Okay, that's fine. I think it was. I think we had agreed on 3 days before.
Yeah.
Yeah.
I think 3 days is great, and including, making sure we've got the time and the time zone and the call-in information and then the topic and everything. I think that would be a great reminder.
Right, and it's always, now in November, I think we're going to change. So it's either 3 p.m. Eastern Standard Time or 2 p.m. Eastern Standard Time. So when the time changes again in the fall, it will go to 2 p.m. Eastern Standard Time, and then you can just figure it from there wherever you are. And we found over the years that that's just the easiest way to do it.
All right. And I will get this to Julie. I also included in there, including Emery's information for the newsletter as well.
Thank you, Melissa. Does anyone have any other new business to come before this board?
I do.
Yeah.
Okay.
Yeah.
Okay, Joseph, go ahead.
It's just a potential affiliation that I've established. I ran into a person, an acquaintance that is out of Michigan, but and she was working with the independent living system up there, serving people with disabilities, but she's now working in the diversity program with Anthem Health. They're a large MCO, Medicaid provider, and I told her what I was doing with U.N.I.T.E, and it sparked an idea with her. They have Anthem Health has a partnership with the state of Oklahoma, and they want to expand on that. And she thinks with the mission that U.N.I.T.E has and with the work that they want to do in Oklahoma, that they might be able to get us a contract. No promises. I haven't heard. I spoke with her on September 1st. So what's that been? 17 days now. She said she would get back to me. So we'll see. It might not lead to anything, but it might. You never know.
Right.
So
that's exciting.
Well, again, she's with Anthem. I don't know if Anthem is active in any of the other members' callers today. If the Anthem Health is in their state, so that was my update. Well, I'll let everyone know if it leads to anything.
Okay.
What was the discussion? What do you mean by like a contract? What do you?
I'm not exactly sure. Her title again is Director of Diversity and Inclusion for Anthem, and they don't have apparently their tribal contacts are minimal. So she wants to see if we can fit within their scope, if our scope fits with their scope.
Okay, kind of like LeadingAge, some kind of partnership. Is that what you're thinking?
It sounds like they would like U.N.I.T.E to be liaison with the tribes regarding long-term services and supports.
Okay. Interesting. Okay. Hey, Joseph, can you make sure you share that with Ron? Or have you already?
Yeah, I did. I let him know. I gave him a heads up about that.
Okay. Thank you, Joseph. Anything else?
Tammy, I know on the call I might have missed. Is someone taking minutes for today?
No.
Are you going to take minutes, or is someone going to?
I've tried. I've tried. So hopefully I can get something out.
Just so we have something. Yeah.
Right.
Okay.
And I kind of think Jared did minutes on the last meeting, but since he's not on the call either, I'll have to ask him later.
Okay. Yeah, just make sure we're getting minutes. I'm sorry, I was a step away for a minute, or I would have offered.
Okay.
I'm sorry, Tammy. Excuse me. Is there a transcript that Kaufman can provide us, just in case, our backup?
They don't record our calls anymore, remember?
Oh, okay.
I haven't recorded them for like 2 years, I think.
Well, never mind. 2 years ago.
One thing, if you do, like Google Meet, I know you can record calls. I don't, because they keep control of it. But I think on some of these Zoom meetings, you can set it up to record it. It wouldn't have to be they don't put it on their website anymore, but we could have it for our use, so we could go back, listen, and type up the minutes. And that might be helpful.
Okay.
I mean, if you just want to, is Melissa still on the call? Maybe they could do that for our next one.
All right, I'll give that suggestion. Yeah, I just know that the host of that meeting has to record it. So even if, like, I know it'll say record. Oh, wait. Okay, I had to make sure. I was making sure my phone, y'all can hear me. Yeah, the host of the meeting just has to be able to record. Everyone is going to say, like, has the recording option, but only the host can record it. So that's just something to keep in mind.
I know you have to ask folks permission, yeah. But I mean, we would just do it for the purpose of someone to review it to type out minutes, because we've got to have the minutes for all these meetings.
Okay. Anything else? Well, with that, then I will adjourn this meeting. All of you have a great rest of your day.
Take care, everyone.
Okay, take care.
Thank you. Bye.
Bye.
Thank you.